Good morning. Today is Saturday, October 31st, 2020. Today is our scheduled yoga therapy session through Sattvic Space Yoga and Healing Studio. Today is a very auspicious day. In the United States, today is a Halloween. Today is also a full moon. It's called Blue Moon. The name Blue Moon came from, this is the 13th full moon of this month. This month is very unusual. This month had two new moon and a full moon. Today is also for Hindu Dharma followers, Lakshmi Puja. Lakshmi is the symbolism of wealth. So, today our discussion will be yoga therapy and ancient wisdom for modern time. So, what does it mean? We'll have a little discussion, then we'll have some practices, and as I always told you, I have all my practices in my YouTube channel, so you can pick up a topic and you can see all the practices. But this is a formal discussion of my practice, my experience, my knowledge, and to pass it to our next generation so that they can use this information for their own studies and for own teaching, and as a permanent archives in a YouTube channel. The information I'm going to share with you, you won't be able to find anywhere. This is all my collection of my whole life. So I want to take a few extra minutes today to discuss, so you'll understand how this ancient wisdom got incorporated in our modern Western medicine. And all of you have already seen and you have known that this is my interest. And my interest boiled down to the writing of my book. And the title of the book is called Yoga Therapy, Ayurveda and Western Medicine, and called A Healthy Convergence. You can see there's two pictures. One picture of Albert Einstein and another picture of Rabindranath Tagore. Albert Einstein is a scientist, Tagore is a philosopher, and the front cover designer, who is my wife, Shikha Sarkar, wrote, watermark illustration of Albert Einstein and Rabindranath Tagore, where a scientist meets a philosopher, and essentially that is our 21st century medicine. Historically, when you look at it, as all of you know, the word yoga came from an English version of its original word called yog, which is written in Sanskrit, means union. It was described as a union of your body, mind, and a spirit. This was a philosophy, this was a practice which was being practiced by the people who are living along the bank of the river. The name of the river is called Shindu Sindhu, Shindu. It is called a Shindu Civilization, which at the present time is in the country of Pakistan, and during the time it was a subcontinent. Two famous cities which are named as called Mohenjo-daro and Harappa. Mohenjo-daro and Harappa now is between two cities in Pakistan called Lahore and Karachi. And this philosophy and practice has been practiced by these people and dating back almost over 6,000 to 8,000 years back. The practice was designed at the time for self-realization. And the people who are practicing this philosophy and practice, they used to follow, it's called a Sanatan Vedic Dharma. Sanatan was eternal, Vedic is the knowledge, Dharma is the faith. This practice also was a very personal, daily practice, and in all practical purposes, it was their own meditative practice. Remember, we talk about meditation is medication. Both the root word in Latin is medere, or mederi. Mederi is the meaning means to heal. Meditation heals, medication heals. Your faith causes healing. Let go, giving away, living in present, keeping your mind focused in one thought is a healing. That's called meditation. So as we said, this was a personal practice and being practiced in private along with the daily routine, which is called a daily routine called dinacharya, and as a part of their lifestyle. It was not they were doing half an hour of yoga practice, 1 hour of yoga practice. It was 24/7, 24 hours a day, 7 days a week, 365 days a year. And people find out that during this practice for self-realization, there were some health benefits. And those health benefits started to come up in our modern day lifestyle. The modern presence of yoga in our society started around the beginning of this century, but it got very popular by a person whose name is Krishnamacharya. I'll come back a little later. But before that, I want to go back how the yoga practice came to United States and how slowly it became part of our Western medicine, which is called integrative medicine. Integrative medicine means the philosophy of yoga therapy with the integration of the science of modern medicine. In United States, in 1893, the first person came and mentioned about yoga was Swami Vivekananda. Swami Vivekananda was invited in Chicago, the Parliament of World Religion, and during his lecture, and the date he gave the lecture was September 11, 1893. It was exactly 108 years before the 9/11 of (2001) in this country. So when Swami Vivekananda mentioned about yoga in the United States, there was a lot of interest. Especially at the time was a spiritual component of meditation along with physical asana and pranayama practice. Around 1920s and 30s, another person came to the United States, Paramahansa Yogananda. Paramahansa Yogananda started a spiritual practice and he wrote a book called Autobiography of a Yogi, and that became a masterpiece in the United States. And he started having a lot of followers. And slowly, it started growing in the Western community. In the meantime, the German who went to India, they incorporated the yogic philosophy, Ayurvedic philosophy, they brought to Germany. Germany was one of the first countries in Europe who started the philosophy of yoga, yoga therapy and Ayurveda in their day-to-day life. During the time of your Beatles have started in British, the singers. They became a follower of a meditation practitioner, and his name was Maharishi Mahesh Yogi. Maharishi Mahesh Yogi introduced a transcendental meditation. This is around your late 50s and early 60s. In the meantime, in parallel, in India, around 1930s and 40s, there was a king in a South Indian stately, it's called Mysore. This is the man who was showing it to the king what the physical asanas, pranayamas and meditation looks like, and king granted him a permission to introduce the practice in the mass community. This is Krishnamacharya. Krishnamacharya had 4 famous students. One is, many of you have heard the name, B.K.S. Iyengar, and after he got trained from Krishnamacharya, he started a tradition called Iyengar Yoga. And what interesting was, the Iyengar himself had a lot of medical problem, and he overcome those with the practice of yoga. And when he started his center, what happened? A lot of people who came and got trained and continuing the practice of Iyengar Yoga, they had a lot of healing, a lot of physical improvement. A lot of their chronic diseases got better. Iyengar then brought the whole tradition to the United States. Then is another one is called Pattabhai Jois. Pattabhai Jois started called Vini Yoga. Pattabhai Jois also brought the Vini Yoga to the United States to introduce. Vini Yoga is a tradition, is called the asana practice along with incorporating your breathing and entering into meditation. The third student was very interesting. She was the first non-Indian, a female student from East European country. She went by the name Indira Devi. After learning this yogic practice from Krishnamacharya, she first came to the United States. She stayed in Los Angeles, introduced this yoga in the United States. Finally, she moved to Argentina, in Buenos Aires, where she finished her last breath. What is interesting is, if you look at these people, Indira Devi lived 102 years. Iyengar just passed away a few years back. He was also 95, 96 years young. Same as your Pattabhai Jois. They live long. They lived a quality life, disease-free, medication-free, quality living. His fourth student was his son, was a Desikachar. Desikachar also introduced his tradition. He passed away a little early, around late 70s and early 80s, and there was a discussion that he may have a complication from a procedure. Anyway, all these four students of Krishnamacharya introduced the yoga practice in India, and they also brought the yoga practice in the United States. In India also, during the time, in 1920, there was a center in western part of India, in between a city called Mumbai and a Pune. It's called Lonavala. There was a Swami Kaivalanand. And we call it a Kiyadham, Kaivalladham. We call it a Kaivalladham. They started research. The first research, yoga as a therapy. They started putting the pressure transducer in their esophagus, in their tracheobronchial tree. They measured the pressure, they measured the blood pressure, heart rate, and they started publishing a journal called Yoga Mimamsa. First one was published in 1924 and is still being published today. Wonderful news. I visited that place a few times. I was the guest speaker a few times. Wonderful place to visit. In the United States, there was an interest by the physicians after Paramahansa Yogananda, around 1920s and 30s or 40s, when he introduced this practice of meditation, self-realization. There was two researchers, one from University of Michigan, his name was Bashu K. Bakchi, another one from University of California, Los Angeles, Marion Wenger. They studied the physiology of people during meditation, and they come up to the conclusion is that the yogic meditation is a relaxation response of the autonomic nervous system without any drowsiness or sleep. That means a meditating person gets the full physiological benefit of sleep without falling asleep. It was published in a very famous journal. It was published in 1957, Journal of EEG, electroencephalogram, and clinical neurophysiology. Around 1967, this was the turning point. So at that time, around the mid-60s, when the United States started having the social changes, social revolution, a lot of yoga practitioners from India came to the United States on their own or with the invitation of the people. First one, as I mentioned the name, Maharishi Mahesh Yogi. He started using the term called Transcendental Meditation, TM. One of the physicians from Harvard University, his name is Herbert Benson. Herbert Benson became interested about Maharishi Mahesh Yogi, and he joined the Transcendental Meditation movement. During the meditation, he noticed there's a lot of physiological changes. He started measuring the blood pressure, heart rate, respiratory rate, body's oxygen consumption, and multiple parameters, physiological parameters, and he was convinced and wrote a book called Relaxation Response. This relaxation response became a New York Times #1 bestseller and became very popular in the United States. What is interesting about the relaxation response is that if you look and read the book, whole contents, the whole physiological changes of relaxation response was nothing but physiological changes of meditation. My opinion in this time is that at that time, in 1967, 68 or 69 exactly, which year the book was published, that he was hesitant to use the word meditation for the common American public, so he used the term relaxation response. This is probably the turning point of Western medicine started looking at the physiological effect of yoga on our human body. As many of you may know, that yogis, by daily practice of this relaxation response and activation of parasympathetic tone, slowly and slowly they learn how to control their autonomic nervous system. We generally have a 3 nervous system. We have voluntary nervous system. I can use my hand voluntarily. This is called voluntary nervous system. I'm looking at a food, my stomach starts to secrete the juices and acids. That is involuntary nervous system. We have another called autonomic nervous system. I'm sleeping, I'm breathing, my heart is beating, autonomic functions are going on, and we have no control on that. But yogis, by repetitive practice of relaxation response and parasympathetic activation, they learn how to control their autonomic nervous system to the point voluntarily they're able to stop their heart, voluntarily they can stop their breathing, and they're still functional and alive. Here came another yogi from India, Swami Rama. Oh, before I forgot, the Maharishi Mahesh Yogi, the Transcendental Meditation, he went to different places but finally settled in a small city in Iowa. It's called Fairfield City in Iowa, but now it is the name, official name is a Vedic city. The whole city is being under your Transcendental Meditation followers, and this is the whole city where they practice the yogic and Vedic philosophy. Swami Rama, when came to United States, now actually he has his institution in Poconos in Pennsylvania called Himalayan Institute. Swami Rama said that I can stop my heart. There's a physician, Dr. Green, I think he's from Kansas, Kansas, and timing I think around 1969. He said, okay, let me study. So he's a cardiologist. He hooked him up with all the monitors at the time, what monitors we have in 69, and he could literally stop his heart. But he could stop his heart, he developed some called atrial fibrillation. When he developed some atrial fibrillation, Dr. Green asked him to stop the practice. But what happened, he was measuring the blood flow in the hand. And we have 2 arteries in the hand. One is called a radial artery, and called ulnar artery. A radial artery supplies blood in one side of the hand. Ulnar artery supplies the blood other side of the hand. When the blood comes in, your temperature goes higher. There is enough blood, the temperature goes down. What he showed to Dr. Green at the time, he selectively could shut down one of the arteries, and there was a differential temperature in the hand. Very impressive work which Dr. Green then published. And after that, a person came to call Swami Kripalunanda, who came from the research, was a Kaivalananda is Kripalunanda, and he established the center called Kripalu. Kripalu is now, I think, the largest yoga and yoga therapy center in the United States. It is in a little north of New York State. It's in between your Boston and Albany. It is about 2 hours west of Boston and about 1 hour east of Albany. It's in Massachusetts, but it is a little north of New York. Very impressive center now. Then also came Swami Satchidanand. Swami Satchidanand also started different centers, but he started a center called Yogaville. Yogaville was a little south of Charlottesville, and the people who are practicing yoga with him also started to develop health benefits. One of his followers is Dr. Dean Ornish. Might have heard his name. Dean Ornish was very well trained and is another physician in the yoga field. She goes by the name Dr. Amrita McClanahan, but her real name is Sandra McClanahan. She is also instrumental in training the therapeutic part of yoga, and also to Dr. Dean Ornish. Dr. Dean Ornish, he was a cardiologist, and slowly he started realizing that this practice of yoga as a therapy is having improvement in cardiac function. And we know how it works. It's a relaxation of the blood vessels, reduction of peripheral resistance, reduction of the afterload. But he could document that it reverses the coronary artery disease, primarily the blockage of the coronary artery disease. He used the practice of yoga, but a lot of people say he used the yoga, the lifestyle, and the daily routine, but these are all as a yoga as a therapy. Lifestyle is a part of yoga as a therapy. Because when I will tell you how the yoga therapy originated, you will understand that the lifestyle is the yoga as a therapy. So Dean Ornish published a book, Reversing of the Coronary Artery Disease, and he mentioned about yoga and a lifestyle, and slowly his program, which is a multiple name he had a spectrum, now is called Intensive Cardiac Rehabilitation, which is being approved by the insurance companies. And in the United States, Medicare and multiple other insurance companies started reimbursing his practice, and there was the centers being built up all over the country. In fact, the city I used to practice medicine, and we have also have a Dean Ornish's program in one of our local hospitals. Slowly, what we started seeing the development of yoga as a therapy in the United States. So historically what happened during the practice of yoga as a philosophy, which is called Yoga Sutra of Patanjali, which are 196 small aphorisms, of which 193 were quieting down your mind. And the practice was the 8 limb. Patanjali, 8 limbs. It's called Yam, social restraint, Niyam, personal restraint, Asana, the physical posture, called your Sthiram, Sukham, Asanam, stillness, happiness in a posture. Pranayama was a voluntary regulated breathing. It was never a breathing exercise. Pranayama is not a breathing exercise. Pranayama is a conscious. Remember, breathing is both subconscious and conscious. Subconscious, when I'm sleeping, I'm breathing. That's a function of my brain stem, lower part of the brain. I'm awake. I can take a deep breath in and out. Conscious breathing, it's a function of my cortex of my brain. So breath is a connector between my unconscious and conscious mind. So breath is a connector of our mind. Pranayam, prana is a life force. It gets, yam is a control and restraint. When this subtle energy get control and restraint, that is your pranayama. Pratyahara is called control of your senses. The 5 senses is the root cause of controlling 5 senses. Dharan is the focus, you're focusing your mind. 7th limb is meditation, dhyan. In the meditation, you enter into in between your thought process. Slowly and slowly widens the gap, so your mind stays very quiet. You are not yet thoughtless. You still have the thoughts, but there is no repeat thoughts. There is no chattering of your mind. There is no chitta vritti. There is a chitta vritti nirodha. Controlling the chattering of the mind, and finally it's called a samadhi. It's the union of your body, mind and spirit. But during that practice, this yoga was infused with hand gesture or spiritual gestures. We call it mudras. And mudras are very therapeutic. Mudras are called health in your hand. Bandhas, called the locks. Root lock, abdominal lock, chin lock, and all 3 together called a great lock. They have a profound physiological impact in our body and mind. Kriyas is called the physical cleansing of our bodies. There's 6 kriyas called tratak for our eyes. How to do the eyes? To look at a flame or look at a point without blinking. Blinking, remember, also is voluntary and involuntary. Blinking also connects your conscious and subconscious mind. Neti, washing your nostril, jal neti, sutra neti. Then you are putting your oil in the nostril, oleation of your nostril. So your neti. Dhoti is washing your stomach. You wash your face, wash your nose, wash your eyes, everything. You also wash your stomach. All different ways of doing it. Kapalbhati is called pranayama. We do it a very active exhalation, passive inhalation. So when you do very rapidly, it becomes a kriya. Nauli is like your abdominal lock. Breathe out first, take a deep breath in, breathe out, suck your stomach in, isolate your rectus muscle, move your rectus muscle side to side, massaging your internal organs. Finally, it's your basti. It is washing your colon. It's like a regular, what you call enema practice. It also became part of a daily yogic practice. All becomes a part of your lifestyle. Then came the Ayurveda. Ayurveda, Ayu means your longevity, Veda calls the knowledge. That's my book, Yoga Therapy, Ayurveda and Western Medicine. Ayurvedic philosophy started to get infiltrated with yoga practice, and the whole combination started being called Yoga Chikitsha, or called yoga as a therapy. So when the yoga therapy started to develop in United States, we started first having the first yoga therapy. It became an association first, called International Association of Yoga Therapists, IAYT. It was born in 1989 by two of my good friends, Larry Payne and Richard Miller. And slowly, that International Association of Yoga Therapy became the yoga therapy spokesperson of the United States. Its mission was to establish yoga therapy as a established and a respected discipline, and it was connector between yoga and Western healthcare system. Around 2007, it started having their annual conferences, which is called Symposium on Yoga Therapy and Research. Then they started a research conference in 2010 called Symposium on Yoga Research. And slowly, yoga as a therapy became part of our national healthcare system. Is called the NIH, National Institute of Health. National Institute of Health started a center called NCCM, National Center for Complementary and Alternative Medicine, which started in almost 1998. But later it changed its name. Now the name is called NCCIH, National Center of Complementary and Integrative Health. And all of their directors are Western trained physicians with experience and training in yoga therapy and a traditional system of healing. International Association of Yoga Therapy, in the meantime, started to have a definition of yoga therapy, which primarily has a lot of big definition, but primarily it boils down to that the application of the yoga practices for the health benefits. And this has become part of your adjunct therapy in Western medicine. So, in United States, around 2014, the American Board of Integrative Medicine started looking at the training programs of what is termed as a integrative medicine. The term first started as called alternative medicine, but there was nothing called alternative medicine. Then it became a complementary medicine. Complementary medicine also did not answer all the questions, so it finally became integrative medicine. Integration of traditional system of healing with the science of your Western medicine. If you look at the United States, the medical schools, here you call medical schools instead of medical college or medical universities, we have about 140 medical schools now, around 140. I don't know exactly number, it could be a little bit more now. Around about 37, 38 osteopathic schools called DO, Diploma in Osteopathic Medicine. 20 years back, hardly about 3 or 4 medical schools had a department of integrative medicine. Now probably had over 100 schools have a department of integrative medicine. Over 60, 65 has a training program. Now they've established a 2 years fellowship program in integrative medicine with 1,000 hours of training. And the American Board of Integrative Medicine started a separate specialty called integrative medicine and started a board certification in 2014. From 2014 now onwards, we have about over 20 fellowship program. Now after medical school, you have to do a residency, either in internal medicine or any other discipline. Then you have to go to your subspecialty. It's called subspecialty called your integrative medicine. Very well established field now and being used in United States for your healthcare benefits. International Association of Yoga Therapists in the meantime started your standards of yoga as a therapy. Your accreditation of the schools, how long will be the training program. It started certification of the certified yoga therapist. And basically it became an adaptation of the yoga practices as a part of yoga therapy. Remember the definitions, there's a lot of definitions about yoga therapy, but what it is, you have the same practices. Remember, this practice came from thousands and thousands of years back. It used to be called your oral tradition. In Sanskrit called Guru Shishya Parampara. Means Guru means teacher, Shishya means student. From the teachers to student, it was transmitted by the oral tradition. The person who wrote down this oral tradition, his name is Patanjali. So that's why the philosophy is called Yoga Sutra of Patanjali. The practice is called Patanjali Ashtanga Yoga, 8 limbs of yoga. Today, there's a lot of physicians who do prescribe yoga as a therapy. When I was teaching outside in person for a long time, I saw a lot of people come from the physician's recommendation. And we have all the testimonials. People who have a inoperable coronary artery disease, people with a multiple medical problem, people with Parkinson's disease, multiple sclerosis, how did they improve? We have hundreds of people in this town who got better with yoga therapy. Now, as a practice-wise, what we do, we incorporate the knowledge which you have gained by now in our Western medical practices. What we find out that the conditions where yoga as a therapy is very effective in Western medicine, first is a chronic low back pain. There is no other better therapy than a yoga therapy for chronic low back pain. Multiple papers have been published and in a respected medical journals like Annals of Internal Medicine your call it JACC, like a Journal of American College of Cardiology, JAMA, Journal of American Medical Association, and we call it a Bible of Medicine. It's called the New England Journal of Medicine. New England Journal of Medicine has a recent article by our Herbert Benson, who first started the physiological changes. And the article was about a mind-body medicine. When the first paper was published by Karen Sherman about the chronic low back pain, this was explosion in our Western news media. She's been interviewed by every news media in the United States. Then came what interestingly, which most of the people still really don't understand, is the yoga therapy for cancer. Cancer people, when they're having the usual and customary treatment, surgery, radiation, chemotherapy, all the complications, side effects, everything got a little better and better with yoga practice. They sleep better, less complication from their chemotherapies, and we know all the reasons and physiology behind it. Got a big funding for a cancer hospital. It's called your MD Anderson Hospital. Got a big funding for study of yoga therapy and for your breast cancer. Multiple papers have been published. Lorenzo Cohen published a paper, and from India there was a multiple research articles coming out. And if you look at PubMed, we have the biggest researcher from India called Shirley Tellis. She had hundreds and hundreds of papers published in established medical journal. Today, if you want to look around, if you go for a PubMed, PubMed is the search engine for all the physician users in the United States. If you put yoga therapy, you will see over 5,000 articles, a little more. Very interesting, in the West, they said that yoga and meditation is separate, which for us, meditation is the same as yoga practice, is a seventh limb of yoga. There is nothing called yoga and meditation. Whole yoga is meditation. It could be yoga asana and meditation, but again, if you put the meditation, you will see over 7,000 articles. So it's a very accepted treatment in a cancer therapy now as the adjunct therapy with traditional surgery, radiation and chemotherapy. Powerful tool for non-communicable diseases, NCDs. NCD starts with your truncal obesity. But the truncal obesity, which comes from your stress, comes from your high cortisol level. Truncal obesity is the omental fat, which is inside your abdomen, which secretes a molecule called inflammatory molecule. It causes inflammation, pro-inflammatory molecule. It causes diabetes, hypertension, coronary artery disease, and high cholesterol or dyslipidemia, called your high triglyceride at a low HDL. These are the diseases, lifestyle-related disorders, and yoga therapy is termed as a lifestyle medicine. Wonderful therapy. Hypertension, because of the relaxation, your peripheral resistance goes down, blood pressure starts to come down. Coronary artery disease, same. The coronary arteries which are in a tight spasm, the endothelium is broken, all the calcium, all your cholesterol gets deposited, which slowly and slowly blocks it. It opens up. Relaxation response opens up. Inside lining, endothelium become more functional. All the bones and joints, arthritis pain, knee pain, hip pain, all the pain, chronic pain, it comes from the tightness. When I have a knee joint, cartilage is broken. Cartilage doesn't have any pain fiber. My body tries to splint the body. It tightens up the ligaments, tightens up the muscles. Yoga therapy is a relaxation response, activation of parasympathetic tone. Wonderful therapy for chronic pain from your arthritic changes in the bones and joints. It brings a balance. The whole yoga therapy practice is using the both sides of your brain, right brain and the left brain. Right brain is intuitive, left brain is analytical. And when the balance is brought back, it's a wonderful practice for your Parkinson's disease, neurodegenerative disorders, Parkinson's disease, multiple sclerosis. Then we can go on and on and on, but these are the primary diseases which gets better and better and better. So, let's go ahead and show it to you how we incorporate the yoga as a therapy in our Western medical practice. Remember, it's an ancient wisdom in the modern time. So, when a patient comes to me or patient comes to us, we examine the patient. In Western medicine, we have a protocol called a SOAP. Subjective, objective, assessment, and a plan. From the practice of yoga, we have seen the changes in our body and mind. Other important thing, I forgot to mention, yoga as a therapy is a wonderful tool for our all neuropsychiatric disorders, all the mental health issues. And I'll show it to you how it is being overcome. And also learning, that is yoga therapy, learning how to use the different tools. Like people who comes with a physical challenges, you start with a very mild relaxation. Sitting in a chair. Sit down in a chair and start doing it a gradual process, which I'll show it to you now, how you incorporate. And also, if you think somebody has a primarily a pulmonary problem, breathing problem, but you first do some relaxation response. You do some relaxation response, relaxation of the muscles of respiration, and slowly you improve your pulmonary function, lung function. Lung function gets better, your heart function gets better. Why? Because when a person is dying, what happens? You say expire. Last breath comes out. When lung stops, then the heart stops. Heart stops, then the brain stops. Brain stops, all the cellular function stops. So improving your lung function through your yogic pranayama practice improves your heart function, improves your brain function, improves your cellular function. So here is my cells in the pancreas, my beta cells, probably not producing enough insulin, or I have enough insulin, is not being properly activated in my cells, so-called insulin resistance. By able to improve your pulmonary function, we are able to improve the cellular function. So learning how to use this tool for different clinical condition. Somebody who comes from a mental health issue, we might start first doing a little bit of a visual imagery, a little bit of a mind meditation practice, very mild relaxation response. Remember, meditation means preparing your body and mind through your breath, so the meditation will come to you. Say, for example, with our yoga practices, we have seen a practice of yoga will cause a proper shape of your body. Proper shape of the body will be, your body will be straight. Keeping your spine straight is the first therapy in yoga. Yogic Bmi. Yogic Bmi is very important. In a Yogic Bmi, how simply, when you have a proper body from yoga practice, if you put your wrist and put your finger here, you will have an overlap. Generally, you have an overlap. This part of your thumb is about an inch and a half. Inch to inch and a half. Take the same hand in the middle of your arm. When you put there will be separation between your two fingers. And your separation will be around inch and a half. It's an ideal body shape called Yogic Bmi. Very important issue is your called truncal obesity. So if you put your thumb on one side and slowly bring your middle finger, both the finger will touch at the level of your belly button. Yogic Bmi, shape of the body. If you look at your thigh, in between your knee and your iliac crest here, you got the middle of your thigh. In the middle of your thigh, if you put your finger, you'll be able to put your finger around the middle of your thigh. You take a look at it. This is the shape of the body. Shape of the body will come with yoga practice. Relaxation. Relaxation of the muscles and ligaments will allow you. So, example relaxation is, we'll start showing it to you how to do it in stages when a person comes. But here, I'm in an easy pose, Sukhasana. Sukhasana, I can go to Siddhasana. Heel in the back, put my feet there, my knee comes down. I don't make any effort. It comes because I have been practicing without any pain, with effortless breathing. From here, put my one foot on the top. This is called your half lotus. Swastikasana, half lotus. From here, I can take the other foot on the top. It's called your lotus pose. I can sit down in lotus pose because it's a relaxation response on my body and mind. Shape of the body. Always the spine is straight. Flexibility of the body. Strength in the body. Strength. I have my hand strength. My whole body strength. See, I put my hands on both sides, I push my hands slowly, my whole body will go high up and stay high up. Tulasana. My whole body is high up. We can do a peacock pose, Mayurasana, Mayuriyasana. A lot of strength, and you can see your strength gets better and better. Your hand grip, strength. When you grab it, close it, it becomes very strength. Shape, relaxation, strength, then get a balance. You do equal on both sides. The one you can do, if you can take a look, what you can do equal on both sides, how to incorporate. This is the incorporation in your Western medical practice. So if I do a cow face, I can put one hand, I'll touch it here, I'll hook it, clasp it, literally a handshake. I can go always to the back and the other side. I've shown you enough. It's all in my YouTube channel. You'll be able to see. I can touch, hook, handshake equally on both sides. If you do alternate nostril breathing, we activate both sides equally. Balance. Stand up, you'll see the balancing poses. So, think about a case scenario. Person comes to you, how to incorporate. So the person has a depression. And first sign of depression, you will see as a physician, the person is literally hunchback, face is down, not even looking at you. Even a physician, you tell them, why don't you sit down? Sit down in your chair with your spine straight. Open your eyes, look at me. That may be the beginning of the therapy for this depression. And we know for sure that you use antidepressive medication, which increases your neurotransmitters. Yoga practice increases your neurotransmitters. Breathing we know, they call it, this Kapalbhati Pranayama, ignites your digestive fire. It helps in your digestion of your food. When you help digestion of your food, there is no toxic material. It's called ama. It helps you in your non-communicable diseases. Pranayama improves your pulmonary function. Longer exhalation than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. We practice longer exhalation than inhalation, completely effortlessly. Also we know the sign of health. Strong digestion, easy elimination, good night's sleep. There are practices, 5 or 6 asanas to improve your digestion, called improving your Agni, igniting your Agni, igniting your digestive fire. 5 asanas for proper elimination. It's called Shankha Praksalan. Shankha is the metaphor of intestine, Praksalan is the cleaning. 5 asanas. You have the asana in practice for a good night's sleep. To sleep like a baby, sleep like a yogi, put your feet together. It's called your laying down closed angle pose. Sutta Baddha Konasana, put your feet together like a cobbler pose and let both the knees drop down. Or like a yogi, sleep on the left side. In fetal position with using your hand supporting your head. I've shown all these things, all of them. I'm just connecting with you how we incorporate this ancient wisdom with our modern medicine. So, when you look at a person coming to you, subjective. A patient is going to tell you what his or her problem. Then you are going to give some leading questions with the understanding of the yoga principle and philosophy. Your leading question will be, how is your sleep? What does sleep has to do with a mind disease process? Because if you are laying in the bed, turning and tossing, not falling asleep, there is no healing of your body. People ask me, how long have to sleep? Sleep, there's a lot of things about sleep. I have the whole YouTube section, yoga therapy for insomnia and sleep apnea. You can take a look at it. So I will give him a leading question. How is your proper elimination? Do you eliminate well? Are you a problem in elimination? How's your digestion? I know the science of digestion. When the food is not properly digested, yoga says that you have a smell in your excreta. Your urine smells, stool smells, your perspiration smells. Urine, stool, perspiration. When you belch, it is a bad smelling. Even if all the toxins in your lung, carbon dioxide, all your volatile, trace elements, they also became. You can smell it. Our dogs are very expert in diagnosis. They can smell. They can smell by my exhalation, my out-breath, and make a diagnosis. In fact, you can make a diagnosis of 450 diseases by analyzing your out-breath, exhalation breath. So how is your digestion? How is elimination? How is your sleep? You incorporate. When you're assessing, you are assessing. You will do all the physical diagnosis, finding. They're also assessing how is his posture looks like, how the flexibility looks like, the balance looks like, how the strength looks like. How's the breathing? Is the breathing nice and easy or very rapid and shallow breathing? Rapid and shallow breathing is a sign of your sympathetic overdrive. Your mouth gets wet. When you have a parasympathetic activation, you get a saliva in your mouth. Your mouth stays dry. It's a sign of that you are in a hypersympathetic mode, creating the disease called non-communicable diseases. Wake up in the morning, your mouth is dry, your mouth is wet, your nose is stuffy. Why? The sleep. The sleep is through your nose, nostril. Yogis do a lot of practice. They use a little oil in the nostril to keep the nostril free of dryness, stickiness. All the air goes through your nose for you to sleep. When you sleep through your mouth, you develop sleep apnea. You don't sleep well. Wake up in the morning, mouth is dry, you did not sleep well. So examining the patient on the light of your both Western medicine and also from the yogic perspective. Assessment will come that if you understand the patient's body type, whether it's a Vata, Pitta and Kapha. Vata is a mobile, Pitta is attributes of fire, Kapha is attributes of your water and earth. Your diabetes is Pitta dominant diabetes or Vata dominant diabetes. In addition to your medication, you can adjust the lifestyle. What happens when you find out, you start your usual and customary practice. You incorporate your traditional system of healing. Slowly and slowly, traditional system of healing takes over and you are able to reduce your support of your medication. And maybe in the process of withdrawing the medication. So outcome of yoga will be better management of the disease, reduction of the pharmaceutical support, and better quality of life. And during planning, you can say that, we are starting usual and customary therapy from a Western medical perspective, but we are also incorporating the yogic therapy, yogic daily routine, yogic lifestyle. We'll tell you, get up in the morning, sit down in a squatting pose, drink a glass of water, have a proper elimination, do your tongue scraping, wash your nose with a neti pad called a jal neti, and do a daily practice of this relaxation response. Come back after 6 months, we'll see. 6 months, I see, yes, his blood pressure is stable, maybe even coming down a little bit. I, as a physician, what I do, I say, okay, your blood pressure is going really well. I'm going to cut down your medication slowly, see what happens. On the other hand, in the hypertension, what you see, you start with one medication, it doesn't work. Then you do 2 medication, do 3 medication. So, if person comes to you who doesn't have any idea what yoga therapy is or yoga is and how to incorporate, we have done the subjective, objective assessment from all the Western medical perspective, yogic perspective. Now we say, okay, let's incorporate the yoga practice slowly. For us, we've been doing for a long time. Our beautiful practice is able to sit down in a squatting pose. If you can sit down in a squatting pose, look at that. Every part of your body is relaxed. Your ankle is relaxed, knee is relaxed, hip is relaxed, back is relaxed, whole body is relaxed. Put your hand, separate your fingers like this, your hand gets relaxed. More and more you separate, the tightness of the hand, fingers are like this. The relaxation, fingers will go like this. Your hand will turn around. Your whole body says relax 24/7. Extend your wrist gets relaxed. Put your one elbow inside, other elbow inside. So how easily you can do it. Slowly bring your hand close to you. Keep your spine straight. Look straight. Close your eyes. Lung is like a balloon. Breathe out first. Now you breathe in effortlessly. So breathe in, count of 2 in, and breathe out with a count of 4 out. Very easy. Exhalation longer than inhalation. Breathe out first. 1 and 2 in. 1 and 2 and 3 and 4 out. We have been doing it for so long, we can keep on doing, but you do only what your breath will allow. Completely with an effortless ease. Absolutely no effort. Just to give an example, I can do very easily, I can do count of 6 in and count of 12 out. 6 seconds in, 12 seconds out. Breathe out first. Wonderful practice. You can continue. For us now, very easy. Count of 8 in, count of 16 out, count of 10 in, count of 20 out. From here, the wonderful yogic practice is able to get up without a support. When you get up without a support, and you practice daily. Sit down, comfortably and get up without any effort. Another wonderful practice is this will come to you, but I'm showing it to you when you incorporate the practice. Able to sit down, which is Thunderbolt Vajrasana. When you sit down in Thunderbolt, your spine is straight, head is supported, get a profound relaxation, activation of parasympathetic tone. Whole digestive tract is supplied by parasympathetic nerve. Your food gets digested. Thunderbolt, squatting pose, and when you get up from your squatting pose to the high up, you keep your body spine straight, like your ear, shoulder, hip, ankle in the straight line. Able to stand up, and when you get your whole hand high up, you'll be like a stick. Dandasana. The whole body will be like a stick. And that's the way you will walk. That's the way you keep your body all the time. So, at the beginning, for the next few minutes, let's show you. You can sit down in a chair and you can do it. Person comes to you, you're first going to incorporate. First you sit in the chair, you sit down, if you sit in the front, keep your spine straight. Sit down with the spine straight. Hold your hand, it's okay. Close your eyes and incorporate your breathing. In yogic practice, breathe out first. Then you breathe in effortlessly, breathe out longer than breathing in. Muscles of respiration gets more and more like called neuroplasticity. It gets better and better. Or if you go to the back of the chair, same way, back of the chair, keep your spine straight. Always sit down. If you're driving your car, keep your spine straight. Eating your knife and fork, keep your spine straight. So once you keep your spine straight, the relaxation response sets in. Why? Because all of our muscles in the back contracting, keeping our whole body erect. Otherwise my skeleton will fall in front. With the relaxation that you can do with the straight, first you relax your hand. Do like a baby. Put your thumb inside and close. It's called Ujjayi Mudra. You can put your hands in the front with the breathing. Breathe out first. Deep breath in, thumb inside and close. You can put your hand and slowly rotate your hand. It's a very nice rotation, your hands and wrist, forward and backward. Forward, wrist gets relaxed, extension, breathe in, breathe out. All do it with spine closed, as a very simple practices to look so simple, but it's a profound physiological effect. And you slowly incorporate in your Western medical practices. All the physicians ask me, how can I incorporate yoga therapy in my practice? Answer is very simple. Why don't you start practicing yourself? Shoulder, put a hand in the shoulder, bring your elbows together, breathe in, breathe out. I practice every single day. With my eyes closed, breathe in, breathe out. Breathe in, breathe out. Do the opposite. Breathe in, start the opposite side. Neck, very important, neck relaxation. But also you relax your body with a prayer pose to the back. Always remember, say we have all the health parameters. We have all the health parameters here. We see all of our physiological changes. So we're talking to you, we call it evidence-based medicine. Evidence-based medicine is a Western medicine, this is also evidence-based medicine. But yoga therapy is also called your practice-based evidence. Practice-based evidence means you keep on practicing, you'll have the evidence. So slowly take your hands to the back. I've shown you so many times, you can see in my practices, and turn your hand, put it like a prayer pose, and push it to a little bit of higher. The asana has stages. Beginning, muscle contracts. Ligament tightens up to let you get into the posture. But be sure there is no pain. Be sure you're able to breathe effortlessly. Effortless breathing means you can talk. You can even sing. You can breathe. And able to hold the pose for a longer time. Initially 5 breaths, 10 breaths, but for us, we can do it for a lot longer time. This has become part of our body posture. And with this, we quiet down our mind also. How do we quiet down our mind? We create a vibration. Generally, we practice a breathing technique called a bumblebee breathing. We shut down all of our 5 senses. We close our eyes, create a vibration. This vibration has the same frequency as the frequency of your brain. 2 frequency interacts, cancels, and with a profound level of relaxation response. What is the incorporation? What is your integrating this ancient wisdom? The modern medicine is integrating a relaxation response, integrating an activation of parasympathetic tone to the therapy of the usual and customary therapy for the Western medical practices. So I will be practicing, I'll be moving my neck in 4 different directions. This is called a Brahma Mudra, and with a vibration, the sound of a bumblebee. My hand is in the back. Slowly I'm talking to you, my relaxation is setting in. The muscle starts to relax. Before it's relaxed, sometimes it gives a little bit of a twitching called fasciculation. Twitching goes away, it's called sthiti, stability. Then you get a profound relaxation. In Sanskrit called arambho, sthiti, visarjan. Visarjan is a profound relaxation. So, breathe out first. Take a deep breath in, slowly drop your neck to the back. Breathing out with the sound of a bumblebee. vibration cancels the vibration of my brain and my body. I stay in a profound level of relaxation. Also the vibration, I extend my exhalation. So I can put the neck on one side now, breathe out first, second stage, deep breath in. Opposite side. Looking at the back. Then rotate your neck first from left to the back to the right, then right to the back to the left, with the same sound of a bumblebee. Drop your head down, breathe out first, a deep breath in. Slowly take both of your hands, keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you can remove the glasses. Use the hand as a cup, put it over your eyes, let the eyes take all the heat from your hand. Then you massage your forehead, massage your eyes, massage your ear, massage it behind the ear, in front of the ear, the tragus, external auditory canal, because this is what called the auricular branch of the vagus nerve. Auricular branch of the vagus nerve activates your parasympathetic activation. After your face, all the muscles of the face are attached to the skin. So if you do that and the muscle gets relaxed, your wrinkle goes away. In the neck, you massage the side of your neck. These are called carotid sinus. When you massage your carotid sinus, it activates your parasympathetic tone. Massage your back of the neck, brings your hand slowly in front of you. This relaxation response will relaxes you enough that you will feel the relaxation of your neck, of your back muscle. Initially, in the back, it feels like the two brick is sitting here. But now it feels like the two pillows are sitting here. You will feel your whole body slowly and slowly gets relaxed. Sitting down, you can do a little bit of a spinal twist or spinal rotation. First, you do a little side to side. Put your hand, drag it over, put it over your head. Slowly raise your hand high up and drop it down. Then you breathe. Breathe out first, deep breath in, then breathe out. Breathe in, breathe out. Slowly hold your hand. Left hand holds the right arm, right hand holds the left arm. Put both of your forearm over your head. Breathe out first. Take a deep breath in. Slowly turn your spine to one side. And keep doing your breathing. Breathing out longer than breathing in, within 5 to 10 breaths. I'm showing it to you, but during practice you'll be doing a lot longer, more and more. And even when I showed you the position of the neck, generally in my practice I do about 5 times, at least 5 to 10 times in each one. Breathe out, take a deep breath in. Always do with your breathing, and you will see that relaxation sets in. You can do your little bit of a back bend, you can hold your hand, keep your spine straight, bend the spine, breathe out first, deep breath in, slowly drop your body to the back. It's a wonderful back bend experience. Side bend, or you can do twist, like put your one hand on that, other hand to the back. Breathe out first, take a deep breath in, slowly twist your spine and stay. Look almost to the back. And then do the breathing. Breathing out longer than breathing in. Come back in the middle. So these are the practices we incorporate in a Western medical practice very easily. Hold your one hand, other hand to the back. Always remember, in yoga therapy, you don't master the asanas, you don't master the poses, but you use the poses in stages for its therapeutic benefit. So what happens, when you talk about a practice of yoga, you think about somebody put the body in the shape of a pretzel and you said, no, this is not for me. That may not be for you, but this simple, gentle relaxation is for you because it will definitely improve your multiple chronic diseases. If you want to do a simple forward bend in the chair, what you can do is support your hand, put your hand on your thigh, slowly put on your knees, slowly drop your head down, and one hand in the front, other hand in the front. Bring your head close towards your body and stay in the posture. Then relax when you get up. You should get up slowly, one step at a time. Lower extremity help, hip, knee, all help. Eagle pose sitting in a chair. See how beautiful it is. Sit down in a chair, spine straight. Take one foot in the front, take the other foot, go behind, wrap it around and stay here. And if you're sitting in a chair, stay in this. If you have a table, you are doing writing, doing all of your work, the feet stays like this. Close your eyes, you breathe in and out. Knee problem, hip problem, ankle problem, this will be a miracle solution for all these issues. Again, in balance, change it. Take your right foot. If you have an issue, don't do it. Stay here. Stay here. That's good enough. If you're going to bring it back here, it's good enough. But stay. Stay in the posture. You don't have to, again, master the poses, master the asanas. Use the asana in stages. So now I'm comfortable enough, I'm wrapping around it. So I also came in stages. Many a time I'm eating on my dinner table. My dinner table height will be somewhere here. I'll do my foot like this, I'm eating. In fact, when your mind is doing something else, your relaxation gets better and better. I might even read a newspaper. I'm reading a newspaper sitting like this. This is good enough practice. You don't have to master, because by the time you can do this, every asana will come to you. You will be able to do your Lotus pose, you'll be able to do your Thunderbolt pose, you're able to, you can name an asana, you will be able to do it. Same thing happened for me. I was like a stick. I was a surgeon. I was operating with my head down, never paid attention to my neck and back. It was almost like a frozen stick, frozen shoulder, chronic low back pain. These are not going to kill me, but these are going to make my life miserable. Simply breathing technique, pranayama. The only pranayama you need to practice is breathing out longer than breathing in. Then you practice 3 simple pranayama. Bhastrika pranayama, you can do hand, breathe in and breathe out, breathe in and breathe out, or you can do simply so when you're normally breathing, if you use your hand, use your Adhi Mudra, this is called your relaxation, thumb inside and close your eyes, you breathe out, take a deep breath in slowly, breathe out longer than breathing in. Breathe in. So if you're doing the breathing out longer than breathing in, neuroplasticity will set in, it will become like a habit, and you will be breathing like that even when you are sleeping. If you look at a baby, that's where the baby sleeps. If one of the bellows, Bhastrika, same way you can do the hands, you can always do it your little shoulder, or you can do it very gently. First gently do. Always do the eyes closed, you will do better and better. If you want to do it faster, the way you do it, Very, very important practice. And you incorporate this very slowly in your practice. You do a jalneti every morning, or you get some drainage comes out, is entirely normal. You can do even faster. But remember, it has to be an effortless breathing. You know, you can continue. How long? First, what your body will allow. Effortless practice. In daily practice, you recommend 1 hour practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. You do 3 to 5 minutes of bellows. Kapalbhati pranayama, you have seen, you can see just bring your awareness to belly button, push the belly button back, and use the different hand mudras. Dhyana mudra, Vayu mudra, Shindu mudra, Prithvi mudra, Varun mudra, Shakti mudra, Apana mudra, Apna Vayu mudra, Linga mudra. So all the mudras are called mudras in your hand. I have again a YouTube channel, Health in Your Hand. All the mudras and acupressures are there, have a whole section. Again, just simply put your hand. See how slowly you can incorporate this. Belly button goes to the back, air comes out. Active exhalation, passive inhalation, removing all the toxic materials. Slowly incorporate alternate nostril breathing. Use your left hand as a mudra. Right, close your right nostril. Breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril with your hands, so the ring finger and little finger. Breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. Continue. Left nostril is control the right brain. Right brain is cooling. Right brain is intuitive. Right brain is female. Left nostril is cooling. Parasympathetic. Moon energy. Right nostril is controlled by the left brain, which is analytical, heating. Right nostril is sympathetic, sun energy. Balances both sides of the brain. You can always do Vishnu Mudra. Put your index finger and middle finger. Keep doing it. You can balance. Put your hand, hold your, I have all these things on my practice, but you incorporate slowly. Even when you take your cardiac medication, diabetes medication, hypertension, do this thing, you will see the demand for this pharmaceutical support will start to go down slowly and slowly. You do Brahma Pranayam, bumblebee, you close your all the 5 senses, put your index finger, close your 5 eyes, close your ear, close your mouth, breathe out first, take a deep breath in, You're pumping and cupping. It's a wonderful practice. You do the practices throughout the whole day, sitting in a chair. Remove your glasses, put your hands, let the hands, eyes take all the head, massage your forehead, massage your eyes, massage behind your ear, in front of the ear, face, front of the for carotid sinuses, and the back. We practice all the bandhas, that's what we do. But it all will come to you. Yoga says in stages, impossible become possible. You can do Ujjayi Pranayam, which you have seen, with your abdominal lock. You'll see the stomach will go in because it's a relaxation. There will be a chin lock and then you breathe through your left nostril. All parasympathetic activation. Because vagus nerve supplies your larynx. A gentle relaxation activates your larynx. Chin lock activates your carotid sinuses. In fact, holding your breath activates your vagus nerve. Left nostril is a cooling. Chandra practice. So simply like this, you breathe out first. Take a deep breath in and breathe out. So actively incorporate a relaxation response of the asanas, relaxation response of the pranayama, your bellows, Vastrika, breath of fire, Kapalbhati pranayama, alternate nostril breathing, Anulom Vilom pranayama, bumblebee breathing, Brahmi pranayam, Ujjayi Pranayam. Incorporate a lot of vibrations. Cooling, Sitali Pranayam, Sitkari Pranayam, this is called Plavani Pranayam, Pranayam. And then when you incorporate this, when your body is relaxed, breath is completely effortless, meditation will come to you. When the meditation comes to you, you sit down with your spine straight, your hand in a relaxing mudra. This is called touch your index finger and thumb, put it over here. In a meditation, what happens? All of your thought process, the thought process which you generate daily, 30 to 40,000 thought process. Most of the thought process are in the past, many of them in the future. At the present, your very thought process. Yesterday was a mystery. Yesterday was a history. Tomorrow will be a mystery. Tomorrow is the present, a gift, and take it. Very, very important concept. You do visual imaging. Close your eyes, follow your breath, and slowly you'll see, you'll be able to do an alternate nostril breathing without closing your nostril. If you're doing with me, let's do it. Very simple, it will come to you. Close your eyes, visualize your breath. Visualize your breath coming in through your nose. The air gets filtered inside the nose. Nose is like a personal air conditioner. Outside air is cool, it warms it up. Outside air is warm, it will cool it down. Air goes to the side of the nostril called turbinate. It directs the air going to your larynx, towards your trachea, to the lung. Goes to the lower part of the lung, fills middle part of the lung, upper part of the lung. The lower part of the lung drops almost down to the level of your belly button. Hold your breath for a short time. Slowly you develop. There will be a normal cessation of breathing. It's called Kebal Kumbhaka. Empty bowl meditation. Visualize air is coming out through the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, air is coming out through your nostril. Outside your nostril, air picks up prana. Prana is a life force. In yogic tradition, our whole body does breathing. Not only our lung, our skin is breathing, every organ is breathing. Bring the prana through your nostril, behind your throat. Now guide the prana to the organ of healing. I have a heart problem, so I visualize prana is coming to my heart, causing the healing of my heart. If you have a diabetes, visualize prana is coming through your pancreas, do your healing of your diabetes. Your back problem, visualize prana is coming to your back. You have a profound healing of the pranic healing. You can keep your mind quiet, quiet in silence. When you're silent, all the five senses quiet down. Stay in the silence, and also you can do a visual imagery in silence. In your silence, you bring your awareness to your nostril and breathe out through the left nostril without closing your left nostril. Breathe in through your right nostril. Breathe out. Breathe in through your left nostril. Breathe out through your right nostril. So if you stay in silence like this and visualize your breath, slowly and slowly enter into a profound level of relaxation. You will feel in the finger, you'll start feeling the pulsation of your capillaries. You'll feel the sensation is going to go down. Eventually, you put your hands together, put your little finger and thumb, separate your ring finger, middle finger and index finger. This is called a Lotus Mudra, Padma Mudra. It connects your body, mind and spirit. Slowly bring it close to your heart. These ancient wisdom, when you incorporate with the science of modern medicine, it helps better control of the disease. It helps reduction of the pharmaceutical support. It helps prevents the progression of the disease, in some cases even reverse the disease. So wonderful practice to incorporate in a Western medicine. Again, finally do your thumbing and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, then put your hand in the eyes like a cup. Let the eyes take all the heat from you. Massage your forehead, massage your eyes, massage your face, behind the ear, front of the ear, in the ear canal, the carotid sinuses, and the back. It's a wonderful practice, and how to incorporate this ancient wisdom in our modern medicine. Thank you for joining with us this Saturday. It's a little cloudy day outside, but today again he said this is going to be the blue moon. We may not be seeing the blue moon because of the cloud, and today is a very auspicious day. See you again in next Saturday. Thank you for joining.